Thank you very much. The Honorable Minister, members of the Parliament that are here, the U.S. Ambassador to Tanzania, Dr. Batu Senior, the Dean from Harvard, leaders of institutions from Africa that are here, our colleagues and partner from Germany, the youth group that is sitting to my left, there are only 4 of you, but I recognize you, the media, all other protocols observed because of the time for the minister, and I really appreciate her staying here to do this. I also thank Dr. Mary and the team at the AAPH for organizing this and the opportunity for me to speak here. I'm very grateful, and I want to emphasize this. A gratitude to Professor Wofai for what he did 10 years ago, and the team that's been working with him to make sure that the African Research Implementation Science and Education Arise Network was created in 2014. I was privileged to be there, and the work that has been going on with all the leaders, Professor Yemani from Addis Continental, who's now here, Professor Till, Professor David, Professor Mosha, Professor Chukwu from Nigeria. I'm grateful to all of them because of what the Arise is doing, what we will continue to do, but most important, training the future leaders who will take the baton from us when we exit this stage. The question and the greatest but is the number. Africa has the largest growing population of adolescents and youth of any area in the world. These numbers ordinarily should mean benefit for us. But as you look at it, this is from UNICEF. The projection is will continue to increase. In West Africa alone, we are looking at about 32% increase by 2030. That number will be reaching 164 million young people. I said the reasons to invest in them is selfish. Because you have that number. If they are restless, there is no country. They are socially mobile, and they share information that our government and the parliamentarians will appreciate could be a challenge in governance. But being able to look at it, Nigeria, for example, 1 in every 2 individuals is between the age of 18 and 24. Unemployment, out-of-school rate is high. When we don't get it right, we create more problems. A large number of these young people are getting married by age of 18. But as if that is not bad enough, now we have the situation of babies making babies. 25% of them having their first children by age of 18. The nature said the body is ready, but is the mind ready? All the impact of obesity on health, how do we manage it? These are issues that the race for non-communicable disease, if it's not stopped, Africa faces the brunt of the challenges. We talk about economic development, but those who will do it are the ones we are missing. The number of the impact is there. From 5 countries in Africa today have introduced sugar-sweetened beverage taxes. Some are complaining that the amount is not high. Yes, but it is there now. And the effort for this is to forestall the interest of the adolescents in the sugar drinks. They are the target for beverages. They don't have the money, but their parents give it to them. So rather than digging the hole, we need to look at it. When you look at what has been happening in countries that invested in SSB tax, like Mexico, the result has been very interesting and very productive. And the gains from it are there. But what is interesting is what my colleagues in Nigeria are saying, that we are killing two birds with one stone. We are trying to forestall the issue of challenges in the adolescent with obesity and the sugar drinks, but they also saw it as a source of income for the health system. The only problem they face is that the presidency will have to decide whether that tax is allocated to health system or everybody share in it. I'm sure the other parliamentarians that are sitting here will challenge our health minister that the tax is not for her alone. But the beauty of it is that the shooting beverages taxes came out of research, the implications of it, and how to move it forward. We still need research to follow it, to see whether the implication is there. Are we getting the benefit that we wanted? That is not the only one that we are doing now. You've seen a little bit of this, and I'll come to it. The school feeding program is also another intervention that is being brought. Nigeria introduced the largest school feeding program in Africa before the COVID. The idea is simple. If the child gets 1 meal a day, the likelihood of dropping out of school is reduced. Nigeria has one of the highest out-of-school adolescents. 40% of those who are supposed to be in the senior secondary school are on the street peddling stuff. What future will a nation have with that? But without research, could we have come up with the school feeding? Today, the school feeding, like the sugar tax, is helping the entrepreneurs who produce the food, how to continue it, to make sure it works, to make sure we get the dividend, and the benefit will have to come from the research investment. That is one critical area. The African Research Implementation Science and Education Network over the last 10 years has done a fantastic job. And you already heard about this. This is one of the long projects that we work on. Have about 16 or 17 institutions in Europe working with African institutions supported by the European Commission. The value for this project, if we get the result we're looking for, is going to be valuable to the minister and everybody in terms of translating it. Second one, this one is from the German government Ministry of Research and Education. The RHISSA, the Site for Health Innovation in Sub-Saharan Africa, has come up as one of those important areas. Just like PEPFAR has been doing and bringing SUCOS, this is also bringing strengthening for research and how those research can impact. I know this because I spent 2 years topping. I've never written a proposal where you have to review it 7 times, going back and forth. But this is superb. And Professor Till and the group, Jake, all worked so hard in putting it in place. But one of the things we need to remember is the former Prime Minister of Norway and former Director General of WHO made a statement that for me is one of the critical take-home that we have to have. Good science is the basis of good public health. We are doing good science. They recognize all the academia here and clap for everyone. But how to take that good science, how to translate it, the best sciences that we have, into public health policy, this is where the challenge is. And this is why I raised to this point so that before the minister leaves, the creation of a think tank is one of the platforms that we are looking at to shape policy implication of investing in adolescent and research health. We also need the input and contribution of everyone that is here as stakeholder to make sure that this think tank which will be hosted by the African Academy and the Arise, with some work from our own university, makes it to where it is. Why do we need a think tank? We've studied in academia the different perspectives of the cycles of making research and information sharing, translating them. This is from one of our colleagues. The reference is not showing at the bottom, but I have a reference on it. Translating those and making it happen. We know that the minister and the parliamentarians are too busy to read Lancet. We don't expect them to get New England Journal of Medicine to see the new things that we are doing. Neither will the community read those. But can we build a bridge between the academia, the knowledgeable, and everything in those sciences, and the decision makers to translate what we are finding to make a difference in the communities? To get these three axes working together, we propose the creation of the African think tank as that bridge that can allow us to translate research innovations into strategies and policy options that can guide activities of the government and the community on adolescents and youth. And what we are looking at is to have think tank committees that focus on different domains of health: nutrition, reproductive health. UNFP talk about this, and you see the babies making baby with all the effort they put into it. But if we are able to look at the information we have that is relevant to our communities and countries, make recommendations on how that information can be used, but we will see the increased use of research outputs in policy making. If we do it right, we see more efficient use of global research resources. The funding that we get from NIH, GIZ, European Commission, and my own third fund, so they don't tell me not to come back to Nigeria, can go a long way to have it. But if this think tank of leaders, including you all here, is able to look at who we are, what we have, and how we can tailor it, then it can make a big difference in terms of what we do for adolescent health research policy. We're talking about not only moving it, we will still get the young people becoming professors by publishing in leading journals, because we will do total coverage of what we have to facilitate the uptake of the policy options that we are peddling. Each of the publications that you see from the Special Thematic Working Group will be useful for career development, will bring experience to the young people, but not only that, it will give us an overview of research, the information we have, and the critical point of making sure that our options are asset-based and impact-driven. If we import options and strategies that do not fit into our system, then the policymakers look at you and say, where do I get the money to do it? Where's the head manpower to deliver it? During the pandemic, we ran into trouble at the port of entry to have port health monitor people. We need to have strategies that take into consideration who we are and what we have. If we do this bridge right, the Honorable Minister, not only will we be able to get to the target stakeholders. Our first target for the think tank output are government decision makers, you and your colleagues in Parliament, to convince the President that research in adolescent health is important. I didn't mention how much our African countries invest in research because I know much about it. I spend a lot of time calculating and working with them. So that when I need a nursing home or assisted living, they will not say they've never heard about it. This is the sentimental reason, the Honorable Minister and the colleagues here, to support translating adolescent health research and innovation into policies. You as stakeholders, your perspective makes a big difference. Let us hear what you want to see do better. What the data we are bringing in show. The community aspirations is critical, and the potential impact. Future of our nation can be assured if we do it right. Honorable Minister, we need to align the adolescent youth needs and the assets that we have in generating policies. Those policies we took from before are useful, but we also need to demonstrate the effectiveness of what we adopted, because that's the only way where you can justify to the president that the budget given to this Ministry of Health is working. But the greatest question is, can we use our assets effectively to drive positive outcomes for adolescents and youth health in Africa? This question is the one that all these three segments must answer: the academia, the decision maker, the communities, and the implementing agencies that are working with us. Because if we answer it, then the future looks bright. When I grow up, I want to be looking and demanding to telling people, yes, the future of Africa looks bright. Because we have all these nice people here, and they've taken the time to listen to me. Thank you very much.